I'm Ann Wilkey, and I'm a registered nurse and co-manager of the Cardiac Rehab Department here at Putnam County Hospital. With heart disease, there are certain risk factors that everybody needs to be aware of. Those risk factors are grouped into two different categories. There are controllable risk factors, and then there are some risk factors that are not controllable. So first I want to talk about the ones that are not controllable. And those are things such as your age. The older you get, of course, the more susceptible you are to heart disease. Your family history. So unfortunately, if mom or dad had heart disease, you may also have heart disease. And your gender, being male, you have a little higher prevalence of heart disease than being female, but keep in mind it is the #1 killer for both men and women. And your race, African Americans, Asian Americans, Native Americans, they all seem to have a higher incidence of heart disease than Caucasians. So then the risk factors that you can control or modify through lifestyle change or medications include hypertension, elevated cholesterol, obesity, smoking, diabetes, physical inactivity, poor nutrition, and stress. So I want to talk about each one of those. Hypertension, the latest guidelines are that they want your blood pressure to be less than 120/80, 120 being the systolic or the top number, and 80 the bottom number or your diastolic pressure. The next one, elevated cholesterol. Total cholesterol should be less than 200, and that breaks down into 3 other components. The first component being triglycerides. Those should be less than 150. HDLs, or high-density lipoproteins, also known as the good cholesterol, should be greater than 40 for men and greater than 50 for women. And then your LDLs, or your low-density lipoproteins, that's the bad cholesterol. It needs to be less than 130. Or if you have heart disease, your doctor may want that even lower than 130. Obesity is another risk factor for heart disease. The guidelines are that we need to have our BMI 25 or less, and that's for men and women. And to calculate your BMI, you'll need to know your height and your weight, and you can go to the internet, and there's several calculators on the internet that you can calculate your BMI with. Even losing 3 to 5% of your body weight can reduce the risk for coronary artery disease. Smoking is another risk factor. Smoking affects not only your heart, but all the vessels in your body. So it's bad for every organ in your body, your heart, your lungs, liver, everything, kidneys. If you are a smoker and you're interested in smoking cessation, please call your physician or Putnam County Hospital, and we can hook you up with one of the smoking cessation programs that are available here now in Indiana. So the latest guidelines are that your blood sugar for people that are not diabetic is to be less than 100. But if you are diabetic, please check with your doctor. They may have a different guideline, especially for you. Physical inactivity is another risk factor for heart disease. The American Heart Association and the Center for Disease Control both recommend that we exercise 150 minutes a week. And you can break that down into 5 30-minute sessions if you would like. Poor nutrition is a risk factor for heart disease. We are recommending that everybody follow a heart-healthy diet. And that heart-healthy diet would include a diet that is low in saturated fat and trans fat, a diet that's high in fruits and vegetables, a diet that's high in whole grains, low-fat dairy, poultry, fish, beans, legumes, and nuts. Stress is another risk factor for heart disease. So if you have a lot of stress in your life, you need to try to eliminate that stress. And if not, you at least need to try to manage it. One way to manage that is to have realistic goals in your life and manage your time. And then if you still are having problems with stress, you can notify your physician. There are many benefits to exercise. You know, exercise can help you manage your weight. It may help lower your blood cholesterol level or lower your blood pressure. It can help you have stronger bones, joints, and muscles. Exercise can also lower your risk of falls, lower your risk of diabetes and cancer, and it can reduce your risk of heart attack and stroke. But most importantly, exercise will give you more energy, you will sleep better, and you will feel better. It is never too late to be fit. The time to start is now. Surround yourself with support. Find a group of people that walk that you may want to join and walk with every day. You can join a local gym. And you should do something that you enjoy, whether it be walking, swimming, biking, dancing, or bowling. Any of that is considered physical activity and counts towards that 150 minutes of exercise that you should have each week. And you should do it your way. You don't have to have fancy clothing or fancy shoes. You just need good supportive shoes if you're going to do a lot of walking. And also importantly is you need to reward yourself. So at the end of the week, if you've hit that 150-minute goal, reward yourself. Watch a movie that you've been wanting to watch, read a book, go out with some friends, but you should reward yourself for the good effort.